Merhaba, ben Doktor Ebu Bekir Türk. İrlanda Sağlık Bakanlığı kayıtlıyım. Doktor Hammad Hassan İngiltere'de, Doktor İmran İqbal Tahir de İsveç'te görev yapmakta. Görev yaptıkları yerler hakkında soru soracağız. Konumuz koronavirüs, Covid-19. Bakalım orada gündem nasıl, hastalara nasıl yaklaşıyorlar, doktorların çalışma şartları neler, kendilerini nasıl koruyorlar, nasıl eğitim alıyorlar. Can you introduce yourself?
Hello, thank you, Dr. Turk. My name is Hammad Hassan. I'm one of the medical doctors speaking from Manchester, England. I am currently working in the gastroenterology department and I am a junior doctor.
My name is Imran Tahir, speaking from Sweden. I'm an internal medicine residency doctor. Happy to be here.
Can you tell me the current situation in your countries?
So, COVID-19 has changed the way life has been in England over the past couple of months. Whilst initially something unknown, slowly we have become more and more accustomed to it. Lifestyles have changed. People are currently in a nationwide lockdown. Our healthcare system has changed and adapted to the new roles and responsibilities it has and needs towards this virus. Unfortunately, there have been a large number of people who have been infected, and furthermore, a significant number of people who have sadly passed away. Thankfully, the virus, whilst quite infectious, is still manageable by our healthcare system.
And is there a curfew there?
Yes, there is no unnecessary movement or travel outside of your house unless absolutely necessary, for example, for shopping or for an hour of exercise per day. But generally speaking, this is quite strictly enforced.
For Sweden, it's been very hectic, and it's getting more and more hectic in the hospital. And generally, in the country, the death rates not being what we expected, because we've seen that the coronavirus has made an entry into the elderly care homes, and this is where people have been hardest hit by this pandemic, and this has been one of the most unfortunate situations in Sweden. But the situation is still under control, but it's escalating to a level where we would need more people, more staff, qualified staff, and hopefully we will flatten the curve, but we're not there yet.
And I wonder how they prepare doctors in the United Kingdom and Sweden. How do they educate doctors?
So throughout the course of the virus, because we have to remember there were initial stages where the country was adapting. There were stages when initial adaptations were met and were not met in some respects, and now people are much more used to what is going on. Initially, we were getting guidance from sort of governmental and healthcare providers, so to speak, so national government, Ministry of Health, the World Health Organization, and with time, local healthcare regions, so local provinces began to develop their own personalized routines as well, because every region in England is slightly different in terms of its approach to the virus. For example, in London, a large urban centre, they were dealing with it differently. In rural centres, they were dealing with it differently. In places where they have large intensive care support, they were dealing with things differently. So for us, primarily, because I work in a district hospital, it covers a large area of land, but not a large population. Our guidance was slightly different. We were informed using emails, using online seminars, initially group meetings before distancing came into effect. And now we have clear protocols and pathways that we follow in terms of dealing with suspected and confirmed cases.
So what you were saying is there were different approaches in the beginning, but now...
Yeah, so now there is more of a unified approach towards dealing with the issue, because now we have much more experience and we have much more information from around the world as well, from Europe and outside of Europe too, in terms of how to manage patients, what to look for, signs and symptoms, etc.
What about Sweden?
Yeah, well, we have daily meetings online where our boss and bosses, they go through, first of all, update us on the situation in the hospital, in the region, in the country itself, and which stage we are finding ourselves in. So these meetings are both to keep us updated on the situation, what's new, so we can discuss this. And this is how we do, because obviously we cannot have physical meetings with lots of doctors present due to this situation. So online digital meetings is how we do it. And there are quite a few of them. And not just about what's new in terms of coronavirus, but how to deal with, how we have to become better with dealing with patients we do not resuscitate, and how we have to make those decisions early so we don't make it difficult for the colleagues later. And so these discussions have also led to something positive in the way the healthcare will in the future deal with certain type of patient groups. So yeah, there are different aspects to it, and there's different ways of communicating, but yeah, this is the situation. We're making the best out of it.
What are your current methods of detecting positive patients, PCR, CT scan, etc.?
So the main method used in my hospital primarily is PCR. It is cost effective, it is quick, and it is easily accessible, which is something that CT scanners are not. Unfortunately, most hospitals have a limited access to CTs. They might have 1, 2, 3 scanners, but unfortunately the turnaround in getting a patient into a scanner, then taking them off the scanner, cleaning it to make sure it's ready for the next patient, takes around 20 minutes. Now, if you take that in 1 hour, you'll get only 3 patients, and in the space of a day, you'll only get a limited number. So with PCR, you can mass test as many people as possible, pending laboratory infrastructures. So PCR is the primary method. We use clinical judgment firstly before we do anything further. Does this patient meet certain criteria? Are they showing clear symptoms or clear signs in any which way? Do they have a raised temperature above 37.8? Do they have a new dry cough, myalgia, etc.? Now, if these conditions are met, then they go for PCR testing and a simple plain chest x-ray, plain film, which should be normally enough to detect or at least give good enough indication as to whether or not this patient is positive.
I think it's more or less the same in Sweden. You always start with PCR on patients you suspect COVID-19, and now initially the capacity was limited because it was new, but now the capacity is there that we can get answer within 3 hours from taking the test. But there can be challenges, because if the test is negative and you do have a clinical picture which portrays as a COVID-19 infection, then you still have to treat it as COVID-19. You can go further with an X-ray just to begin with, and if you see ground glass changes, then you might have it there, because we know that PCR is there are limitations, both in terms of technique. Is the person who's taking the test, are they equipped, trained enough to do the test in the right way, which can give you a lot of false negative tests, because we know that we've had patients who were negative on 2 occasions, and then on the 3rd time they were positive. In terms of CT, I think the patient has to be really unstable for you to go ahead and in terms of differential diagnosis to do that, because then you really looking at a bigger picture, because there's nothing you can actually do in terms of treatment, in terms of medications. So it doesn't really change the fact too much, but it's good to know, I mean, in terms of the equipment you're going to use, how contagious is the patient in terms of the infection. So these things, but CT, yes, but not initially. Sometime during the admission period, if necessary. Yes. No, definitely not first line diagnostic method. Definitely not.
Personally, none of the patients that I've seen or first contact with suspected patients, I've not needed a CT for any of them.
Yeah, of course.
The PCR, like Imran said, there are issues sometimes with technique and sensitivity of the scan. There are varying ranges of sensitivity, but if your clinical judgment and your clinical picture shows that there is high suspicion, and if you've excluded other diagnoses, then you will treat them as such, or at least you'll mark them as such.
In terms of treatment, what kind of drugs do you use? How do you treat COVID-19 patients in your countries, since different countries have different approaches and different treatments? And for example, Turkey has hydroxychloroquine and azithromycin as a first choice. But I wonder what they use in the United Kingdom and Sweden.
Well, so far we have no definitive medications that we use. From our guidance and our policies, there is no confirmed medications, nothing with any significant amount of evidence to prove its usefulness with so many medications that are being trialed around the world. It's good to trial medications to see what works, but for the moment none of these are being used. Sometimes we do use, for example, the likes of azithromycin and amoxicillin, but this is to treat underlying infections, not for COVID itself. The only treatment for COVID is the definitive treatment is oxygen support. The main symptom that COVID patients tend to suffer from significantly is desaturation and requiring large amounts of oxygen, and this is where the hospital comes into play and intensive care units come into play. So in terms of medications, there's nothing specific we use.
I think it's the same here. We moved away from whatever we tried initially, hydroxychloroquine, azithromycin, even Remdesivir. There is no evidence which suggests that these medications have any effect. And even the studies that exist are not very convincing in terms of the conclusions due to the number of patients and etc. It's per definition there is no treatment in terms of medications.
So in Turkey, plasma transfusion is getting more popular every day. What about in the United Kingdom and Sweden?
We have not started using plasma transfusion. Again, in terms of our policies and pathways, there's no evidence as of yet to support the effectiveness of plasma transfusions. This is something that can change in the future, but for the moment, it's not in use.
Is it the same in Sweden?
It's the same in Sweden. First of all, even from the World Health Organization, they say that the patients who had mild symptoms don't really develop any immunity. So this is also on one side scary, but in terms of the question, it's every country is trying different things, different methods to see what could potentially work. But in terms of evidence we have was working. We don't have any convincing evidence about any method as of yet. So it will be interesting to see. What happens. But as I said, there's so much we don't know. There's so little we know. That's why we have to be very careful with the conclusions we draw in terms of early testing with different methods.
So my last question is about herd immunity. What can you say about it?
Well, the Swedish state epidemiologist has been quite open recently that Stockholm would probably acquire herd immunity by end of May, which was probably quite optimistic. The recent reports from World Health Organization suggest that might not be the situation anywhere in the world, that with the COVID-19, you might not get herd immunity. So as it looks now, a vaccine is probably the only way to go. And so herd immunity not working.
Thank you very much for your time. This was the last question. Şimdilik sorular bu kadardı. Merak ettiğiniz sorular varsa siz de yazarak sorabilirsiniz. Sonlandırmadan önce bir hatırlatma da yapalım. Bu video Nisan'ın 30'unda çekildi. Covid-19 ve Covid-19 ile ilgili bilgiler her gün değişiyor. Buradaki bilgiler bir kılavuz bilgisi olarak alınmamalı. Videomuzu burada noktalıyoruz. Herkese hayırlı günler.